Here's a young lady of just 77 years who has significant lung disease. She's shared her pulmonary functions with me many times, and as recently as the last couple of months. So I'm saying if Ms. Cole, if Lynn can find a way to sort of combine 1, 2, 3, and 1 in the back, 4 different liquid oxygen systems so that she can get out and do some competition, within her own peer group, that is the ultimate form of rehab. And truly, this is not patronizing to say, but if she can do it, all of our patients can do it.
Well, I can't.
Maybe not to that degree, maybe not as hard, maybe not as uphill, but a minute a week, 2 minutes, 3 minutes. As she said, at the end of a year, you're doing an hour, pretty close. So, Lynn, would you please describe this rather remarkable kind of golf cart, but not kind of baby carriage, but not remarkable. Let's call it the Oxy cart.
Yeah.
Okay, I just made
Baby
it up.
jogger stroller.
There you go.
I was as weak as a kitten when I was diagnosed needing oxygen, and it took me a good 2 years to get back to normal. And my normal was pretty darn good, I have to admit. But I really never walked more than 3 miles, and I wasn't an athlete. I used to swim a lot. That made my lungs bigger. That was of benefit. But after rehab, 2 years, I got better. Then I got the Transtracheal, and my walking buddy said, well, Lynn, you can do a half marathon. He said, come on up to Georgetown with me. It's 8,500 feet, and you go downhill, all downhill, yeah, right, at altitude down to Idaho Springs. And then we even went up to Loveland Ski Basin parking lot, which is over 10,000 feet up in altitude. That's where going uphill for 200 feet, I did need 24 liters. And then going downhill, I only needed 15. Most people don't need this many things, but I needed volume in order to last 3.5 or 4 hours of walking. So in order to carry all my things, I could carry 1 tank in a little collapsible umbrella type thing, or the big solid thing. So I chose this. Big wheels go over everything. And so I started doing half marathons, and since 2004, I've done 15 of them. Believe me, 1 or 2 a year is enough.
Including the Colfax, right?
Including the Colfax, which I opted out of this year because I got the opportunity to go to the Thoracic Society meeting, and it was a good excuse. I'm a little tired, so
I'm gonna let you not rant, but go on essentially your favorite topic, because you do a very good job at telling other patients start with a half a foot a day, but just do a half a foot the next day.
That's right.
Yeah.
You start.
Tell the camera.
You start at the level of what you can do. If it's only 8 steps, which, believe it or not, with severe people, that's very common. So you start, you walk your 8 steps to the potty chair or wherever you're going, and then you get off it and you go 1 step beyond and 9 steps back. Even only 1 step a day. 1 more minute per week of exercise. If you think about it, that's 52 minutes of moving a year. You're going to be better at the end of a year. You just can't be impatient. You have to do it 1 step or 1 minute at a time. I did 3 minutes a week, and I got back to where I could walk 3 miles, and then it's a commitment to go a long time walking, but I did the half marathons walking. Now I'm cutting back to a 5K, which is only 3.1 miles. I figure I'm going to rest on my laurels. Right there.
There you go.
And so I will still use this going out, but I won't need as many tanks because it rolls over the gravel trails here, which are harder to tow a little cart with smaller wheels. So this is very beneficial for taking longer walks. People have probably seen those little umbrella open, what are they called? strollers
Stroller, yeah.
for a little baby to go in the store that collapse in the car. You only need one tank, get one of those. But this I like, you can lean on it, you can even do tripod position here. And it's, if anyone tells me, oh, you're hiding the fact that you're using oxygen with a cosmetic factor, oh, come on, here it is. Am I really trying to hide the fact that I'm on oxygen? I don't think so. Or I walk with a backpack on my back. This is one of my larger ones, but it'll allow me to go out for 4 hours on 4 liters or 1 hour on 15 liters.
Do you have a POC in the house?
P. And this is really my passion. Since I got on oxygen, I wanted to learn about every piece of equipment possible. I happen to need the largest one, the Eclipse 5, which goes up to 3 full liters continuously or 1 to 5 pulse. And even that, being at altitude, won't hold me that well, but it's a fabulous machine. I with a smaller machine, the Simply Go by Respironics, and I get the providers or suppliers will let me use the different ones for a week, and I test them out on the cannula. I just tape off my transtracheal. I test them out on the cannula. I test them out on the transtracheal. I test them out on different cannulas. Oh, the OxyView glasses.
True.
That's on my other cart.
As a matter of fact, you will combine
I have to
therapies.
combine. I am needing, like, if I want to walk 4 miles an hour, which I can't do much anymore, but I need 16 or 18 liters for a long period of time. So I wear the OxyView glasses and I use 4 liters into my nose, sometimes 6 continuous. And I combine the tanks, and then I use, in the transtracheal, 12 to 15 liters. It's recommended 12 liters, but I've found going hours on 15, and it hasn't bothered me in any fashion. But I love testing equipment. I've tested all the face masks. I've been the person that's, Ann Hensley of Respironics, she used Lou and myself as subjects of how to teach people to fit.
And what about patients that are literally just Googling portable oxygen concentrators, finding one that seems to be a little bit less money than the other one?
Oh, please, don't go by size, don't go by weight. Do not go by size or weight. Go by how well it will hold your oxygen saturation. Now, we all cheat a little. We all cheat a little and go maybe down to 90% just so we can make it last longer, especially if you see you're running out or the battery is running out. But for the most part, you want, if you could get to a place where you plug it in, you want to get it right back up there. You do not want to cheat yourself. To cheat yourself now using oxygen, you can set yourself up for getting pulmonary hypertension or cor pulmonale and yucky things, way more yucky than a hole in your neck. You can't reverse it. You can't reverse COPD either, but you can modify it with drugs and medications and exercise. But you do not, you want to use that oxygen every minute. Don't think you can get away with it. The consequences are severe.
Thank you, my love.
Big hug.
I love it.
I hope it works.
I think it will. I think it's going to be great.